Hemorrhoids, also called painless, are swollen veins in your buttocks and lower rectum similar to varicose veins. When the walls of these vessels are stretched, they become irritated, causing hemorrhoids. In this video, we're going to look at what hemorrhoids are, what causes them, how to treat them, and finally how to prevent hemorrhoids altogether. So stay tuned till the end. Hi guys, you've seen Arsalan Media Pharmacist here on YouTube. This week's video is on hemorrhoids. Smash the like button below to help this video be seen to more people, as there's a lot of useful information stored in here. Hemorrhoids are usually classified under two types. Internal hemorrhoids, which develop inside the rectum and are usually painless, but tend to bleed. You might have seen this if you notice small amounts of bright red blood on your toilet tissue or dripping of blood into the toilet bowl itself. External hemorrhoids may cause pain and are under the skin around the anus and are a lot more uncomfortable. Nearly 3 out of 4 adults will have hemorrhoids from time to time and can be alarmed when they first get them, which is why I wanted to make this video, to give you tips and tricks to hopefully help prevent future hemorrhoids. Hemorrhoids has a medical term, and it's not only used to describe the medical condition. We all actually have them, and they play an important structural role. They're basically cushions made up of blood vessels, connective tissue, and muscle located on the anal canal, and the purpose is to help ensure that leakage doesn't occur on its own, because that'd be bad. But what ends up happening is, if these veins tend to stretch under more pressure than they're used to, bulging and swelling end up taking place. This can be from a number of different issues: straining during bowel movements, sitting for long periods of time on the toilet, having chronic diarrhea or constipation. Pregnancy can even put you at risk for them, obesity as well, and not to forget, a low fiber diet can cause them too. So let's not neglect some good old fiber. To treat hemorrhoids, there will be a variety of different approaches and products that will need to be applied directly to the area. They consist of creams, gels, foams, suppositories, and pads. I won't go over all of them, but I'll cover the main ways to treat them and recommend a product as well for each. You can find a link to everything I mentioned in the description below, so don't forget to check those out. The first are Protectants. These include zinc oxide, mineral oil, and starch. They cover the delicate tissue to prevent excessive drying and irritation. Desitin, which contains zinc oxide, seems to be a popular one. Secondly, you have constricting medicines that tighten blood vessels and help shrink tissues. Preparation H ointment is one that has helped and is recommended by most. Thirdly, if itching is your biggest symptom, you could use the steroid cream hydrocortisone, which temporarily relieves and reduces the itching associated with hemorrhoids. Preparation H has that ointment as well that contains the hydrocortisone. Fourthly, you have numbing medications, which numbs the nerves and can provide temporary relief of pain and other discomforts if the pain is your biggest problem. Again, Preparation H has a combination with lidocaine that provides rapid relief. Fifthly, you have witch hazel, an astringent that shrinks the blood vessels, promotes drying, and can temporarily soothe the burning and itching. Also note that there will be a combination of all these types of methods too in one product, like the Preparation H cream with maximum strength pain relief, so you could treat the condition with a combination approach as well. Call your doctor if you have bleeding during bowel movements or you have hemorrhoids that doesn't improve after a week of home care. And remember, many people will get relief with home treatment and lifestyle changes, but if you have large amounts of rectal bleeding, lightheadedness, dizziness, and even fainting, get medical attention right away. Now that the treatment's over, let's look at how to prevent hemorrhoids. The best way to prevent hemorrhoids is to keep your stool soft so they could pass easily, and these 5 tips should help. Number 1, eat high fiber foods. Eat more fruits, vegetables, and whole grains. Doing so softens the stool and increases its bulk, which will help you avoid the straining that can cause hemorrhoids. Remember to add fiber to your diet slowly to avoid problems with gas. Start slowly and gradually increase your intake to 25 to 30 grams of fiber per day. Number 2, drink plenty of fluids. Drink 6 to 8 glasses of water each day to help keep those stools soft. Number 3, consider fiber supplements. Most people don't get enough of the recommended amount of fiber. The average is about 15 grams a day. That's about half the recommended amount. Studies have shown that over-the-counter fiber supplements such as psyllium or methylcellulose improve overall symptoms and bleeding from hemorrhoids. Number 4, don't strain. This creates greater pressure in the veins in the lower rectum. And number 5, avoid long periods of sitting. If you have any tips I forgot to mention, pause the video and leave them down in the comments below. I hope this video was helpful or useful to you guys, and if it was, please share it with someone who you know that could benefit from it. Like the video if you did enjoy it, subscribe to stay on board with all my other weekly health and wellness videos, and as always, thanks for watching.